All right, good afternoon, everybody, and welcome back to the afternoon sessions of our virtual conference. I am very pleased to get the next panel underway. It's titled Monitoring and Evaluation. We have a wonderful presentation lined up for you, and I have the pleasure of introducing Arla Liska, who's going to be our moderator today. If I may, a little bit about her is that Arla has more than 30 years of experience in the provision of human services, ranging from direct service to executive management and consulting. As a consultant to Calgary non-NGOs for 10 years, Arla assisted in evaluation design and implementation, research, program design and development, strategic planning, and multidisciplinary partnership. For the past 8 years, Arla has worked as CEO of the Calgary Drug Treatment Court. Arla is a passionate advocate for drug treatment courts. Her experience supporting startup of the Calgary DTC program in 2007 to 2008, and now as CEO, provides her with a solid basis for understanding processes involved in developing a highly effective DTC program. So without further ado, I'll turn it over to you, Arla, and I look forward to hearing what you guys have to say.
Thank you, Jennifer. Good afternoon, everyone, or good morning, depending on where you're coming from. And welcome to the session on monitoring and evaluation. The focus of this session is going to be on how to establish monitoring and evaluation processes and why it's important to evaluate our programs. And just to tell you a little bit about the format, first of all, we have 3 presenters today who I'll introduce in just a minute. We'll have a few questions throughout the presentation and that we encourage you to participate in. I'll place the questions in the chat and you can respond back in the chat. And we will also have some time at the end for questions. But please do, if questions come up for you during the presentation, please do put them in the chat so that, and I will monitor the chat and then we'll make sure that we get all the questions answered that come up. So I'll introduce our presenters now, starting with Dr. Hannah Scot, who has participated for over a decade as part of the Durham Drug Treatment and Mental Health Court Steering Committee in Oshawa, Ontario, as the university partner providing help with research and evaluation. She is full professor and founding faculty member in the Faculty of Social Science and Humanities in Ontario Tech University. Hannah has a master's and a doctorate degree in sociology. Her specializations include victimology, workplace bullying, evaluation, statistics, and homicide studies. She's worked in the United States and Canada on several interagency initiatives, including a community safety initiative in the US and a national homeless initiative in Canada. She was founding director of the Center for Evaluation and Survey Research at UOIT and served as director there for 4 years. Michael Weinrath is professor and founding chair of criminal justice and director of the Justice Research Institute at the University of Winnipeg. He teaches program evaluation and criminal justice policy courses for honors and graduate students. Over the past 10 years, his major evaluations have included drug treatment courts, mental health courts, diversion and restorative justice programs, therapeutic communities, and adult and youth intensive supervision probation programs. In addition to technical reports for the federal and provincial governments and NGOs, his evaluation work has been published in the Canadian Journal of Criminology and Criminal Justice in Australia, Manitoba Law Journal, the Canadian Journal of Community Mental Health, and the New Zealand Journal of Criminology. And Irene Hoffart is the director of Synergy Research Group, a well-known and respected Canadian consulting firm in Calgary, Alberta. Irene has been providing research and evaluation services to the nonprofit sector, government, and funding organizations for almost 30 years. She brings expertise and skills in developing and implementing action-based and participatory research approaches and is also well-versed in traditional research and data analysis methods. She has a track record of over 60 research and evaluation projects with a focus on domestic violence, homelessness, addictions, children and youth, Indigenous and immigrant communities, seniors, and many others. Over the last decade, Irene has particularly focused on research and evaluation of problem-solving courts, including the Calgary Drug Treatment Court, where she's developed and implemented research methodology and tools, produced analyses and reports, and used a developmental evaluation approach to support program development. Irene believes there are many groups in society that don't have equal access and opportunity to access services to address their needs, and that consulting support can enrich their service delivery and assist agencies to improve sustainability, capacity, and performance. So to get us started off, I will now hand it over to Hannah. You're muted there, Hannah.
There we go. I'm having a lot of technical difficulties today. If I suddenly disappear, it's because my battery died. We have no idea why that's happening, but it looks like it's charging. It just doesn't say it's charging. So we have questions for people. And so one of the questions we wanted to ask, we're going to sort of start each section with that while you're presenting, is how many people have actually have a budget for evaluation, whoever's in the room. So if you could just put an answer in the room like yes, no, don't know, not sure. Maybe we can sort of get a sense of what's going on with respect to evaluation in the group. And while you're doing that, I'm going to put up my slides. There we go. Can everybody see that? Excellent. Okay, so this is me. As Arla said, I have been working with an unfunded court in Durham region in Canada for the last 10 years. It's a different kind of relationship that we have than the other group centers. So I hope to provide a very different kind of perspective on evaluation, and most importantly, why it's so important to do evaluation. So, well-known fact in drug courts. In the most effective courts, the research shows with respect to drug courts, they all have evaluation built in. This is especially true in the United States, where there's a lot of many evaluative studies to show that the best courts that are most cost effective, that are most effective for clients, that have the best programming, that see the largest successes, tend to be ones where the evaluation is built in and funded. So in Canada, in the United States, it's a sort of national funding program, and then it's also supported by the states. In Canada, we have a hodgepodge of how we do this as we start to get the legs underneath us on drug courts and drug treatment courts across the country. So today, as I said, we have the no funding model, which is me, and it's a research partnership. So they found a volunteer to researcher, and I help them with their evaluation. Mike has been working in grant-funded, supported research partner, the research partners at the university, and he's done many evaluations with that mode with a lot more stable funding. And then we have the private partnerships, as done by Irene here, and she's going to talk about what she does and how she does it. So there's very different ways of doing things with very different kinds of partners. So I hope you get something out of that. So you know these things, you know the 13 principles of drug treatment court, but I wanted to draw your attention to the statement here, which says these are principles for successful court-directed treatment and rehabilitation. And so again, the evaluation research shows that when you build in evaluation and question what you're doing and see if it's working, this actually, as long as you adhere to all 13 principles, you tend to have a well-funded court. And so I'm here to talk to you about number 8, which is right there. So this is number 8. It's mentoring and evaluation, measure the achievement and program goals and gauge effectiveness. And so I'm here to say, why would you bother? So no budget, I think Granton, no budget. Yeah, okay, I feel you. So when we do this, Meeting principle 8 is a bit of a challenge, right? Because they want the court to operate, but then nobody really wants to pay for funding, and it's an interagency effort, right? So then it's a, if everybody's putting in a piece, then who's going to be paying for that? The courts and counselors are busy. Certainly mental health counselors are busy. Many of the people, it's very hard to get done. So meeting principle 8 can be very hard when DTCs are unfunded, but it's also when evaluation is not built into the partnership participation. So when you're thinking about a court, or when you're thinking about developing one or improving yours, build in that evaluation into your grants, into however you're getting funding. So there's also a problem when there's no buy-in into the court. So on one hand, it also happens when we sort of prioritize the client and the treatment and the medical side of things and the court side of things, but we don't actually evaluate what's working and when it is. So we often hear things like, well, the clients are most important. We don't have time to do the evaluation. We have no money for that, right? Treatment is important. And we have to really reconsider those thoughts. And when there's unequal participation in the court evaluation process. So for example, in medicine, we see a lot of participation in evaluation. It's sort of a requirement on the health side, but in the courts, maybe not so much, or they do it in fundamentally different ways. And or the police may not be, the best evaluation partner. And the court does require that all these people work together and that it all be funded. Somebody collects the information, and it's good to have a third-party collector to protect the privacy of all of those agents. But it is a crucial factor. So why evaluate? I'll give you a couple of very quick stories. Everybody remembers the DARE program. It's that famous American program, Say No to Drugs, right? It's about trying to discourage children from taking drugs. And it's an after-school program for the most part and funded in every state. And now in parts of Canada as well. But the evaluations of it are mixed in the sense that some larger evaluations said that the program actually didn't work. And it was because it wasn't adhering to the original principles of its program. People were coming into the program, children were coming into the program. When they're picked up after the program, it turned out that the children were more likely to not do drugs. But in some cases, young kids were coming to the DARE program and then they weren't being picked up and they'd congregate and sometimes they'd go do drugs. So in the long and the short of it, meta-analysis shows that the DARE program works usually in the first younger years for the program, but not necessarily as effectively. The program has to adjust and change to deal with the older needs of youth. Another example is community policing. Again, there's ways to do community policing under the original model. What they found was many people had community policing programs that weren't working or they didn't feel that they were being effective. And what they found out is that, again, it had to be done in a certain way. Certain things had to be done. And those programs that were not adhering to the principles of community policing were actually not doing as well as others where they were. So I have the study here by McDonald that said it really didn't affect violent crime, but what it did affect was things like property crimes and so on. So again, trying to figure out where you're effective can be an important role here. So typical concerns we hear about this. So we've heard them all, right? You can add what you've heard in the chat if you want to. Typical concerns, it's house cleaning. We don't need to do it. It's not that important. Client is the priority, right? It's expensive, right? Because when you tell people exactly, when you talk to people like me and you say, what do you need to do this? You say, well, I need I need to have a TA support or a research assistant. I need this. It can get expensive and people don't want to build that in. And they also may not have funding models that allow you to fund other people outside your institution if it's a third-party collector. And it may not be, there's a concern that it may not be favorable, right? We hear about that. Oh, well, what if it's not working? Well, if it's not working, you don't want to be doing it, I think. But I'm going to show you some examples of why we don't need to really think that way. And if the program's not working, we can do stuff about that. But we also have these concerns as the evaluators, but we're not there to hinder the program. We're there to help the program. And this is evaluation and not confirmation, right? Like we want to see what's working, but we also want to see maybe disregard what's not working and save some money. Because remember, every time you're doing something that's not working, you're wasting time and you're wasting money. So evaluation ultimately is cost savings. And I would like you to think about that, even though you see the money going out on the outside, it's because you are making your program as efficient as possible. So trust your team, embrace constructive feedback. You have to buy into that. Remember, you're gauging effectiveness and engage in open dialogue. So really question your program. What are you doing? What have you added? Is it working? Does it enhance the program? Is this helping or hurting the client? Are they just going through this and it's not helping? In that case, there might be, other ways to try to help. So I'll give you an example here of a process evaluation by a student. It was an undergraduate thesis project. I use an unfunded court, so you can have a research partner. I have a student who was interested in drug courts. We just set it as standard evaluation. Is the court adhering to the 13 principles of best practices? And she found that, in fact, the court was not. This was my court. But interestingly enough, what they weren't being able to effectively do were the things that required money. So they were having trouble funding, for example, urine tests. They were having trouble funding anything else that required money in that program, right? And so what we ended up doing here is using this study to fund or to provide evidence for funding and grant funding. And so now our courts are able to have some more funding as a result of this study, because they know that the most effective drug courts do adhere to all 13 principles, but funding is a huge part of it. So the answer was yes and no. The suggested court's not working, but where it was failing was due to lack of funding. And so the study was used to support funding efforts. Another example is, this was a master's student of mine. She was interested in whether or not there's sort of a suggestion that if you go to drug court, that you would stop using emergency departments as much, because they were showing up prior to the treatment and prior admission to the drug treatment court in ED, using the emergency department as a family doc. And so we figured that this would be something that would go down. And in fact, we found it went up after graduation and during the program use. And we were like, but we took it to the court, the DTC people, and said, what might be going on here? And certainly the addiction counselors did talk about the fact that once you, of course, shed addiction, or you start the process of shedding addiction, that you start to pay more attention to your health. And so they are more likely to present at a hospital. And so out of this came a really good discussion about whether or not to integrate something like a family doctor, if we could. So that we could start addressing the health needs of some of the recovering clients that we were seeing. So yes and no, right? Didn't look like a success, but in fact it is a success. And now the court is using that information and seeing if they can find a GP to help. It's challenging in our community, but we're trying. And then we'll evaluate that. So evaluations work for drug treatment courts to support funding requests. So evaluation makes money. Not only does it save money, it can make money if you know and you have the reasoning and things. And the people who follow me are going to, in this presentation, are actually going to show you how to do that and what to collect. And so hopefully you'll have some good tools in your toolbox to save money and make money, not spend money, right? So it evaluates successes. It helps you determine what success looks like as well. Some successes, absolute abstinence is one form of success, but certainly there are other kinds of measures of success that you can use through the program. It enhances the programming, it enhances the treatment to the client, right? Because it's as evaluated, if it's working, it's the best treatment for the client. And it sparks discussion and reflection. And this is something that the program really insists on, is that number 8 principle, that is the magic behind the evaluation. So no matter how they're funded, evaluation is key. Now the trick is when you're not funded, the evaluation in my court is sporadic due to availability, because it's purely volunteer and I have to bring students in who are interested in the process. I wouldn't recommend it, and I think Brampton understands that. But there's other funding models here that are great, that are going to be demonstrated. So I have this picture of scaffolding here. Scaffolding supports the structure, and certainly evaluation is one of those big scaffolding pieces that help support the DTC and make it run efficiently. Other things to consider here, almost done, is that these analyses take time. They don't go like that, and you have to build it in the process, right? So lack of consistent funding, though, can actually become a sort of a spiral down the drain, right? So the idea is that if you can't get consistent funding, you can't necessarily show your programs are being effective, which means less funding. So it can reduce chances for further funding. It can create challenges for continuing to help a client, for example, in a consistent way, because you're not necessarily absolutely sure. You just sort of know or you think it is, but document if it's a success and put that down to help the client. What we end up with is you don't fund a court. There's a danger of running a self-fulfilling prophecy because unfunded court used to get no funding, can operate as effectively, then ceases to be as effective as it could be because it can't meet the principles of the funding parts of the 13 principles and so on and so forth. And there's research to support that not doing all 13 is actually detrimental to drug courts. So thank you for your time. I've chosen this sort of stairs and scaffolding image to sort of, lifting us up as we go. And hopefully I've done that in this presentation. Thank you.
Okay, thanks, Hannah. So just as a segue into the next portion of our presentation this morning, I've just placed a question in the chat. I hope you all received it. And the question is, when is the best time to start an evaluation? At startup, after 2 years, or after 3 years? So if you just want to type 1, 2, or 3 in the chat, we'll see what people think about that, and then we'll hand it over to Michael.
I think actually it was my turn to kind of shifted things a little bit, Arla.
Oh, pardon me. Okay,
That's
sorry.
all right.
Did I get that in the wrong order?
No worries. It was kind of a last minute thing, so no worries at all. But and I think the question we were going to ask to precede my evaluation, my presentation was around outcomes, right? And whether or not people were able to or are collecting outcomes. So we'd be interested to see that from you guys while I'm talking. So I'm going to share my screen now. So people can tell me if they can see it. Perfect, thank you. So so first of all, let me just say, Hannah, I think that was an awesome case for evaluation of drug treatment courts and evaluation in general. So it's really important, I think, for us to have that understanding of the value of why we're doing all this work. So thank you, I really appreciate it. So my portion of the presentation today is more about practicalities and how-tos. And I'm going to talk about my experience with the Calgary Drug Treatment Court and what information we gather. So my role there has been as a supporter, an evaluation and a consultant, starting with 2007 when we first submitted a proposal for the drug treatment court in Calgary. So it's been quite a wonderful experience, and I've learned a lot and hopefully can share some with you. One of the things to say is that as Hannah was speaking to, not many drug treatment courts have funding for evaluation. And so, a lot of what I'll be talking about assumes that there's at least some dollars available for people to do it. But as I speak to the how to do evaluation, or at least how we're doing it, I'll also identify some of the pieces that are critical to collect. If you're not able to collect it all, at least there are some portions maybe that you can gather. The other thing I'll say too is that there's a different amount of experience with evaluation out there, and some people are really familiar with some of the basics that I'll be talking about, and others, this will be new. So for those of you for whom it's repeated information, please share in comments any kind of suggestions or comments about your own experience. I think that'll be also helpful. So what are the building blocks of the evaluation? So this is whenever you're collecting data of any kind within your organization, these are the three basic building blocks that, if you boil it all the way down to the most essential components, these would be it. And so we've got three things. One is, who is the participant? Who is the person that you're working with, that you're serving? What is their background? You know, we need to understand that so that we can support them and we can understand the kind of experiences people come with. What are the services that we're providing? And so this part of that piece is around monitoring and making sure that there's fidelity to the model, but also looking at what actually happens in the program to support participants. And then finally, outcomes to how are we actually addressing people's issues and people's needs. So quite often what happens is before you go in these directions, you start out with some kind of a, now I'm going to put some terms out there, theory of change or a logic model or measurement framework. Essentially what those are is they allow you to put together these three elements in a way that makes sense within your organization and for your mission and for your vision. So that is something that I would suggest to everyone to do, even if you don't have any money, to do a little bit of that kind of thinking about what is it that you're trying to do in your organization and for whom. So I'm going to talk about each one of those three basic building blocks, and just from the using the example of Calgary Drug Treatment Court and how we collect those data. So first, again, building on a lot of what Hannah had said, you know, why do we need to understand participants' needs, for example? Well, I mean, at a basic level, the case managers need to know what people come with so that they can plan services. We also, it's really important to understand what are the different groups that we're serving, you know, so we might have people coming from different countries, people coming with different kind of criminogenic involvement, different genders, right? And all of these groups come with different needs, and we can't just look at everybody with the same kind of paintbrush. So we also want to be able to engage fully and effectively with other service providers out there in the community, so that, because drug treatment courts cannot provide everything, cannot address all needs. So it's really critical to work together with others. And by understanding participants' needs, we can also understand what service gaps might exist out there and then advocate for some of those service gaps. So what do we gather? What kind of information? So this is real practical piece now. What information do we actually gather about participants' experience? And you can see at Calgary Drug Treatment Court, we gather quite a comprehensive set. You know, each of those statements there comes with its own list of things and detail. So, but I just want to maybe share with you a bit about how we do this, because that's a critical piece. One of the things that happens maybe for people that might be new to evaluation or that might not have you know, a full kind of understanding of the depth of what is intended, is they perceive us sitting there with a, you know, clipboard, checking off, you know, people's responses to questions. That is not, from our perspective, that is not the most effective way of gathering information. In fact, what we want to do is integrate evaluation within service delivery, so that, you know, for example, when we first meet the client, the thing we want to do is establish a relationship with them. And that happens, you know, sometimes over multiple meetings, right? And so we collect this kind of information in that type of relationship-oriented conversation. We have at a Drug Treatment Court database, so I know people without money will say, what? And that's been really, really critical for us, because then we can have that information at our fingertips. So, for example, I can tell you that our participants, when they come to the Drug Treatment Court, 73% were physically or sexually abused in childhood. So quite a significant number are, you know, traumatized. So as a result of that, many have started using, on average, they start using drugs at 13. They start engaging in crime at 19. And most, I think 90%, have no legitimate employment. And about, we actually have a number where 25, where they spend on average $2,100 per week to purchase drugs. So this is an important, like that kind of description really tells us about who we're serving. And that's this high needs, high risk group that is the one of the piece of guidelines of the model. So participants is one part of gathering information. The other part is, what are the services? So what actually occur? What actually do people participate in? So so we can use service data to understand whether services we're providing are aligning with the needs of the participants, right? And to understand gaps in service overall and in relation to various subgroups of participants. So just to share with you some of the gaps that we're experiencing in our area, this is Calgary. So, but probably it's consistent across Alberta and even maybe some in some of our rural areas or more remote locations, it would be worse in those areas. So we have fewer addiction treatment services for women, which results in delays to access. Some men's treatment facilities do not address trauma. There are some places where culturally appropriate treatment services are limited. So for example, if you're working with Indigenous communities or Indigenous clients, the access to elders and ceremony and all of that is really important to have in order to engage people. There are barriers to treatment access for pregnant women. There's lack in availability of childcare for women. So we are collecting this access to service data helps us understand what gaps exist out there. And of course, as Hannah had spoken to about the model, the DTC model, the service tracking also allows us to understand how well how consistent we are with the guidelines. So what is it that we actually track with respect to services? One of the things, so this is for quite some time, we actually tracked services at Drug Treatment Court on paper. And then after a while, it became clear that we needed to have some kind of a way to aggregate this information and to really understand the amount of work that goes into and the type of work that goes into the client support. So the Calgary Drug Treatment Court, again, has a case management software that they're using. Again, I know people without funding will say, what? So that we've been quite fortunate. But in some ways, let me just say this, that there is a bit of a, chicken or the egg. You need evaluation to get the money, you need money to get the evaluation, right? So if you're able to balance both of those things, then you're kind of in a good place. So we do use that case management software to gather information about actually all significant contacts. So what happened in the contact with the client, and the contact means, contact with case managers, court attendants, treatment groups, employment program. So we track all that to understand the full scope of service. We also track progress through treatment. So this means setting goals. So goal attainment scaling for some of you who knows that terminology. And so we really just we work with clients together. It's a kind of a mutual process to identify goals and then see how to support clients along the accomplishment of those goals and then identify barriers that they have. The other piece, and I've spoken about the importance of being part of the service continuum. Calgary Drug Treatment Court, again, is part of the service continuum, so it's critical to track referrals in and referrals out, and who you're working with and where the gaps are. It's really, really helps us to understand where we need to strengthen our relationships. For example, just to give you a sense of about 30% of the staff time is allocated to that external work, to the advocacy work. And sometimes that changes, of course, depending on the complexity of the needs. So the third piece, we've talked about clients, we've talked about services, and the third piece is outcomes. So I think we've talked quite a bit in other places about the importance of outcomes, and Hannah had mentioned it too. One of the things I wanted to really emphasize is how outcomes are different from activities or services, right? You could have clients participate in all the services that they need to participate in, but it's quite possible that they might not be successful, right? So that's why we need to understand the service content, but then we also need to understand, well, what actually happens in terms of changes. So that's one thing I wanted to mention here. The other that's really critical one about outcomes is that it's not just successes that we're looking for. And Hannah, you again mentioned that as well, because it's the purpose of really getting a sense of what successes are is primarily for the purposes of your funder, right? Is to help them understand, yeah, you're doing what you say you're going to do, but it doesn't really help you improve your services, right? So from that perspective, it's really important to understand what maybe isn't working and maybe for whom it's not working, right? So you might have a program that works overall and it looks successful, but then when you dig in a little bit, you might see that, again, so we often see in programs, Indigenous communities might not be as successful. And part of that is because service delivery may not be as culturally competent as it needs to be. So one of the specific examples for Calgary Drug Treatment Court was that we've seen that our outcomes weren't as good for younger people, younger men. And so because of that, we modified the program expectation to increase their engagement with supports, both professional and personal. And that really helped move that group forward with respect to outcomes. The other piece to mention about Calgary Drug Treatment Court is that it has established an early intervention stream, and that is because there were some clients who were less complex that did not require the full extent of the service, and in fact, it was counterproductive for them. And so they could stay in the community. They didn't need to stay in the treatment facility and participate in the program in somewhat of a different way, less intensive way, which actually then allowed the program to serve more people and also to cost less money. So what are some of the outcomes that we actually do collect? Again, I do appreciate that people might not be able to do this all, given the resources that they have available for evaluation, but minimally, I would say retention is probably critical to gather. Retention just simply means what percentage of your client group is discharged and what percentage graduate successfully. And also, how long do they stay? Because we know longer term stay actually results in some good, produces some good results. So the other thing that we look at is addiction, relapses, and sobriety. So this is something we don't expect people to have no relapses, right? We know that in fact that there will be relapses. We're not interested in total abstinence, but we're more interested in behavior, honesty, and commitment. So those are some of the other things we're looking at. The health and other health indicators, we actually gather through qualitative interviews and exit interviews. And just to say, the value of qualitative data collection is really important to put in that context to some of the other data. And then finally, we have the employment program that helps people who are, many of them are in poverty, helps them to become more stable and engage with employment, and the CDTC staff actually support people in remaining in employment. So recidivism, we have been fortunate to look at long-term recidivism of our clients and be able to show the impact, which has been pretty successful. And then the cost savings, where we've done the SROI, I don't know if people are familiar with that term, social return on investment, where we have demonstrated that there were savings, for example, of over $76 million in the cost of stolen goods of a period of 4 years. So those are just some examples of the types of outcomes we look at. And I know my time is probably coming to the end, and so this is the last slide. One of the things I wanted to mention here is that evaluation is not a one-time exercise, or at least it should not be. It should be integrated within your service delivery. It should be continuous, and it should provide information for ongoing learning. So you could see how you would use evaluation data to design and plan, then you collect data, then you analyze, adapt, you change your programming, and then you redesign and replan, so it's ongoing program changes. And I would just say that again, what really helps to integrate data collection in any agency is actually bringing the data to the staff and having them engage with it, and having them understand and speak to what that means to them. So I think I will wrap up here. That'll be the end of my presentation. And the questions are going to be later, as I understand it.
Okay, thanks, Irene. Well, I think we've got all of our questions out there. So Irene's question was, does your program gather data to understand participant outcomes? I'm going to guess, given that the answer to the first question was that people don't have a budget for evaluation, that maybe the answer will be no, or maybe that's an assumption. Anyway, correct me if I'm wrong. But thank you. And so let's move over to Michael. And Michael, I think people did answer your question correctly. And, the ideal time to start an evaluation is at startup, not later. But anyway, over to you, Michael. Thanks.
Thanks, Arla. I appreciate that. Okay, let me move over. Right, so thanks to my colleagues for some excellent presentations. And I look forward to hearing from all of you and receiving some questions later. So all of us have sort of overlapped a little bit. So, but again, we try to, I think, hit the high points, because there's some certain things that we would like you as practitioners to come away with. And so I'll probably reiterate some of those points, but hopefully in a slightly different way, and maybe some more interesting stories as well. So try to contextualize it and give you some examples. Right, so the ideal time to start evaluating is right away, 2 years and 5 years. But it's funny, and I teach evaluation. So most people, when they think of evaluation, they think of the black box, right? They think, well, is that drug court program, is that working or not working, right? People think of these sort of big ticket types of things, right? Did it work? Didn't it work? But evaluation, of course, has a lot more to offer people than that simple yes, no. Not that that's not an important question and that we shouldn't ask it in different ways, but evaluation can do other things. So, and again, I think we've kind of mixed it up. We don't want to get too technical, right? Because we know that you're practitioners, but you're also smart people. And people, now everyone talks about evidence-based practice. And so there is some technical knowledge that goes with that. And so when we talk about evaluation, people make this distinction of summative and formative evaluation. So summative is associated with sort of more black box types of evaluations after 2 years and 5 years. And then you look at sort of the big ticket outcomes, right? And so most of you, I'm sure, are familiar with things like graduation rates, things like recidivism, and then ideally you can look at things like relapse and improvement in lifestyle. And so formative evaluation is a little bit different. It's concerned more with process, right? And how actually the program is running, and also things in and around implementation, right? Which is, again, is process-based. So again, that's formative is generally thought of more with respect to startup and formation, but formative is also associated with monitoring. And although we have talked about monitoring in the first year, and I want to talk a little bit about the importance as the others have touched on, monitoring is also sort of an ongoing type of thing. Okay. Also, I don't want to totally distinguish monitoring from outcomes, because collecting outcomes ongoing is also important. Certainly, I found in my research, and my colleagues have as well. So what is monitoring? Well, monitoring is concerned with implementation. You know, are we implementing what we thought we would? But it's also the practice, if you want to look at the technical definition, ongoing collecting and reporting of data on program activities, products, and outcomes. And that's from Rossi, Lipsy, and Henry, probably three of the best writers on program evaluation. If you're ever interested, there's an American textbook that's worth buying, although McDavid, Hawthorne, and Hughes have a Canadian volume. It's also, I think, quite worthy. Right, so again, you can also look at outcome, but generally with monitoring, right, we're asking the question, right, how are we doing so far, right? And that's a reasonable question. I think the other way also to think about it is, how did we do last year, right? If you're able to do ongoing monitoring. And again, people have talked about funding, but I think arrangements such as Hannah's, where you find academics who, and interest them, right? Because drug courts are interesting, right? There's a lot of things going on in drug court. You got these court meetings, you have individuals with significant addiction histories, you have actually some very interesting outcome measures, you have different models of case intervention. So there's a lot of interesting things for researchers to actually look at that can assist you in evaluation and student placements. And we did a lot of research. Part of it was funded for the drug court, but a lot of it we also did with our students. So yeah, so the reason, of course, that we should monitor, especially from the beginning, is because there are resources. Some of your programs are unfunded, but there are still resources being committed to it. And as Hannah alluded to, sometimes actually we put in resources to things that don't work, and sometimes that make things worse. And so it is important, even if we're reallocating resources to run a program, that we monitor and we ask important questions. And of course, 2 years, 5 years, it's already, it may already be too late. And of course, if your program's not running, you know, very well, it's unlikely to continue in whatever form it is. Okay, so there's three things that I want to talk about in terms of domains of program monitoring and what's important. The first one is service utilization. The section is organization, and the last one is outcomes. I'm not going to talk very much about that because others have touched on it already, but I do want to talk a little bit about issues around service utilization. So again, we have these target groups that we establish. Is that the group that we're ending up seeing in the drug court? And the other thing is just simply the organization of the program, and you know, is it actually working the way it's supposed to work? We said we were going to do this. Is that actually what's being done? And that seems like a straightforward question to you, but in my experience as an evaluator, that's not what is always done. Yeah, outcomes, sometimes it can be quite preliminary, but it is never too early to start collecting those research pieces. And again, you always want to think about whether the changes that you're seeing are due to the program. And again, that becomes more complex to measure. And I thought Irene gave some interesting examples of how someone might go about doing that. Okay. Oh, right. There's always another picture. Okay, this idea of service utilization, the coverage, and that's successful participation by the target population. And so, you know, here's what's interesting, you know, the Winnipeg Drug Treatment Court, which I think has been a very successful program in many ways. When they originally wanted to start up, they said, you know, people in the advisor group would say, sex trade workers, you know, a lot of them are heavily addicted, and gosh darn it, we need to target a lot of these individuals because, you know, they're being, you know, victimized, and we can help them. And yet when it came time to run the program, nobody really thought that, you know, one of the big incentives, of course, of joining the drug court is you're avoiding these lengthy prison sentences, or even, well, I don't know, 4 or 6 month provincial terms, and often federal terms. But the average sex trade worker was not serving 6 or 9 months. They were getting time in custody. They were maybe getting 30 days. So as a referral source, that was not happening. The other thing they said they would do, and a lot of drug courts do it, was they were saying, we're not taking any violent offenders. And yet, when defense counsel pushed and said, well, this looks like a robbery, but basically the person was wrestling with their mother and yanked their purse and ran away, and it's not the most serious, robbery that we've ever seen. And of course, if your drug court is actually going to reduce the use of custody, you need to take people who've committed, serious offenses. So during the first year, there was a shift, right? And in our monitoring, we talked about, the reality that, you could take violent offenders without unnecessary use, right? And sometimes you're doing that based on what you've seen in the program, but sometimes even if you haven't seen the program for that lengthy period of time, if you're familiar with the literature, right, you can actually look and say, well, you don't really, increase risk, you don't increase it that much. The other thing, of course, you're interested in is, do you actually see addicts in the program? And as Irene was saying, it's important to know who's in the program. So the retention rates sometimes for the Winnipeg Drug Treatment Court aren't great, but they take serious offenders. And we were able to chart that for them. You get these drug courts in the US that claim they have a 60 to 70% graduation rate, and you find out they're taking in people for possession of marijuana, and the drive while impaired courts that take people without really any sort of serious backgrounds. So all that information is important to prove the viability of the program, and really, I think to make sure that you're expending public funds on people who really need that sort of help. Okay, and I've talked about the initial period, but also in terms of the ongoing, and Irene was talking about that. And that is, we would report the profile and background. And so when we look at referral, right, like we like to see sort of a balanced referral. So when 60 to 70% of our provincial jail admissions are Indigenous individuals, you'd like to see, hey, let's make sure that our diversion programs have a high proportion of Indigenous people. And so, although it becomes difficult depending on the severity of the individual and the background, we did actually push for more inclusion of Indigenous referrals as a result of our tracking things each year. And again, in coverage, we looked at the efficiency of referral, and we went away from a more elaborate addictions assessment. And there's nothing wrong with that, but they were taking like 2 months for people who are sitting in custody, which was not an efficient way to do things. Right, and so again, if you've done a needs assessment, and most people haven't, or if they have, it's usually not that well done. But if you have a great needs assessment, you know who you're going to target. It's pretty easy to compare, and you can see in your first year if you're reaching that population. Otherwise, program records is how we've done it. Most people do it, looking at the individuals who are in the program and whether they fit their profile of addicted individuals who need the service. Sometimes you will do surveys, observation within the program. Okay, otherwise monitoring organizational functions. And so, people are shooting the arrows or they're hitting the target. It's a good question. And sometimes you have the implementation itself just doesn't work. And I've done evaluations on programs, and I hate to say this to people who would love to have a little bit more funding for their programs, but I've seen people get money for programs, and it seems to happen more often in crime prevention, and they end up not being able to do what they originally said they were going to. So they did other things, right? Like, so somebody was going to do gang sessions for parents, and they're going to run these groups, and then they found out that the parents didn't want to meet, or that it was hard to get them to come to meet. So they ended up doing presentations in schools that had nothing really to do with the original. Another one, they were supposed to coordinate gang prevention programs, and apparently that didn't take much time, and they were trying to do social work with different people. So sometimes you have a program and it's never actually delivered. And sometimes the way you implement the program can end up making the program incomplete. So we had an AIDS information program, idea being to distribute these pamphlets to inmates when they came in, and giving us some information about AIDS and how to protect themselves when they came in. Kind of interesting, with COVID, sort of hygiene is important. But we found that all those AIDS pamphlets were thrown in the wastebasket or dropped on the floor. And we couldn't figure out why was that happening. And gosh darn it, they're supposed to, read those things. Well, the nurse was giving it to them during the admission process, and they didn't want to walk out of the nurse's room holding the AIDS pamphlet and having all the other inmates looking at it. So sometimes the way you implement a program can end up impacting it. Inmates just didn't want to read it to public space. Yeah, so again, I'm going to reiterate what Hannah and Irene have touched on. If you get nothing else out of this, well, one of the things why it's good to get someone involved early on as an evaluator or researcher is the data recording. Because what we found, and what I found in other work that I've done, is people record all kinds of stuff. Staff and social, they love to write all kinds of things, but often they write things that aren't useful. I mean, arguably they're useful to them. They'll write these long, I had an interview with Mary today and she was upset and we talked, and that's great, right? But a page of that may not translate into anything that I can quantify or summarize for researchers at the, or for the stakeholders, funders at the end of the year. So I actually look at things sometimes and say, you guys don't need to record all that. What you need to record is this, this, and this, and you can come up with a shorthand, and you don't need a fancy computer program. You can create a spreadsheet in Excel that can be very easy to update. And actually it's very easy then to give to researchers to use. Yeah, talking about, so again, you can have too much research. When we started, the feds who funded a lot of drug courts initially had this huge database. And it was, I thought, whoa, crap, why would you? I didn't know why they wanted all that data. Well, I shouldn't say I didn't know why. I mean, if you get enough people in a room long enough, they'll say, and why don't we ask this? And why don't... But what happened was people never filled it out, or they didn't fill it out completely. It would be inconsistent. And so sometimes I thought the important things were not being recorded. So, yeah, so I think that evaluators can sometimes help you say, you should record these, and these things. And that way we won't lose the data or have to spend a lot of time and money trying to find that data later. Yeah, United States, trying to discourage traffic stops of minorities. They had the police fill out these cards in one jurisdiction, and they already had a bunch of data that they were collecting, and they just didn't do it, right? Yeah, so again, in our first year, we found there was a lot of data that wasn't being collected. And so we identified a number of things that people could improve on, and they did. Yeah, so again, you need some quantitative data. We collect qualitative data as well. As Irene was talking, we would do exit or follow-up interviews, graduate interviews, and not enough with dropouts, I think, and that's something we'd like to improve on in future work if we do that. So, but in the end, you need some quantitative data. Yeah, just the other thing I guess I would mention that we have done these ongoing monitoring exercises with the WDTC, and then they actually stopped funding that around 2015-16. But we would do something different, right? Like give you something for your money. So we did a comparison study with equivalent probationers one year. Another year, they had our residents that was funded through CMHC, and we did an assessment of that, right? So an ongoing relationship with researchers, sometimes in addition to sort of the good ongoing data, you can get some different things also delivered. Okay, otherwise, I just put in the plea as a social science and an evaluator is evidence-based practice. Everyone thinks that's a great thing. and everyone says, we know what works, or, we have research. And so people, need to contribute to that. So I hope that some of you, when you come away from this, that you, of course, support evaluation, but also think about the utility of sort of these ongoing relationships, right, to help build up our evidence-based practice. So again, you need good data, right? You want to see that program implemented the way it was intended originally, and yeah, adjustments ongoing, that they're logical and end up being effective. Okay, and that's it for me. Thank you.
Okay, thanks, Michael. Great. Well, I'll just share a comment, a brief comment from my perspective. I really appreciated all of your presentations today. I have to say, as a manager in a DTC program, all of what you're talking about is exactly what we experience in our program. That it's so helpful. It's so helpful in problem solving. It's so helpful in really understanding what you're dealing with, who you're serving, how you're spending your time, and what the impact of that is. And so as a manager, it is undoubtedly one of the most important tools I've ever had, is the ability to get that kind of information, because we are collecting that data and we have somebody supporting our evaluation, to be able to understand, answer important questions, and problem solve. And also, maybe particular to a drug treatment court, it also helps with collaborative problem solving and decision making. So our multidisciplinary team, multidisciplinary partners, all also like to understand who are we serving, what's going on, being able to provide some amount of data to be able to describe that, and having it align with what you're seeing builds a lot of trust and openness in communication and planning. So it's certainly been very, very helpful in our program, and I think what you had to say today was very helpful. So wondering if any of our attendees have any questions at this point. If you do, just put them in the chat. Maybe one question, since we seem to have people who maybe don't have a budget for evaluation, and maybe are looking to start up or improve on evaluation. One question I would ask would be, evaluation, all of that can seem a little bit overwhelming to imagine how you'd implement. So I'm wondering about simple techniques or strategies that you would recommend to either get started or to advance, from more of a beginning place, right? I don't have a full out evaluation. What are simple things that can be used? Just to start that, I would say, I know Irene mentioned that we have a database, and in Calgary, we do have a database, but if you look at the databases that are available, some of them can cost, $30,000 or more, and they seem like a prohibitive cost, but we, had one customized. It could easily have been achieved with a one-time grant. There are things that can be done, and when you look at the first layer, it might seem prohibitive, but there are some things that can be done that are simpler and less costly. So anyway, over to our speakers. What strategies are there to get started? Or Hannah?
Well, I think the first strategy is always to get over the. I think drug courts are unique, and they sort of face some challenges, right? There may be no buy-in by some members in your court building, but then there's the people who very much are part of that drug treatment court and believe that it's effective and it worked. So I think part of it is the start of it is just talking to it. It's not that it costs, evaluation costs money. Start talking about how it saves money and how it makes money. I think that's part of it. So change change the people that you're talking to, change their minds. The second thing I would say, if you have no funding at all, and you don't have a university partner like me, who is part of a system, or like these two who have clearly regular funding and have great infrastructure, is actually just start to take stock of what you're collecting. So go around the table at your steering committee and say, what data do you collect, right? Because then you could compare it to some of the other drug courts. I'm sure that everybody's all that talking. I know Irene and Mike would be happy to talk to you about things that they collect. And then maybe have a discussion about what you would like to collect, and let's just see if everybody's going to collect it. And then sort of, if you build it, they will come. And then hopefully once you're invested in the collecting, somebody might actually want to look at it. And I would recommend ultimately, such as we have here, Michael at the University of Winnipeg, who's separate from the court, and Irene, who works as a third party. A third party evaluator is great because of all of the HIPAA and FIPA, so you have to be aware of all of that. And so, you know, getting funding for that third party, and maybe they can talk about how they're funded, because maybe they can give you ideas of maybe how they started to get funded and so on. So that's really my take on it. Thanks.
Any other comments? Michael?
Yeah, I would say Excel is your friend. And so I'd say for those of you who don't have any money but are interested in evaluating and want to start collecting some data yourself, yeah, Excel is your friend. And so a lot of it is just, you know, basic demographic data, right? And a lot of this information is available on your file, but it's a lot easier if you end up, you know, securing a researcher in the future, or even if you want to start doing some stuff yourself, right? So you just have a file number, the name, the date they entered the program, their living arrangements, marital status, whether they were employed or unemployed, education level, the offense or offenses, and then things like drug of choice, first drug of choice, second drug of choice. Just trying to think. Yeah, because all this stuff, I'm sure that you collect it in one way, shape, or form, but it's nice data to have for annual reports. And to be honest, Winnipeg, rather than us root through the files every year, they used to just give us an Excel sheet where they were doing that. They were, not all the information was on there, but a lot of it was. Yeah, I mean, I think like some of the stuff, like recidivism, I mean, you really need to check, you know, different databases. And even for us, right, in Alberta or in Manitoba, we went through provincial corrections and court databases for recidivism. But one year we actually, because it cost money, we got some extra funding, or we took some of our funding and we just paid for CPIC records. And there was one offense outside of Manitoba. They like to commit crimes close to home, I guess. There was one reoffense, and our reoffense rate is very low, by the way, for graduates drug court. And that was out in Calgary. And we actually knew about that because they'd heard through the grapevine the person gotten into trouble. So anyway, yeah, you can record a lot of data, and it'll be relatively easy for people to access and convert into an SPSS or other sort of file. You too can be a researcher. And if any of you are interested in doing something like that, want me to put something together for you, just email me and I'll get something.
Irene, did you want to add something?
Yeah, actually, yes, I do. But I think there's a question in the chat for Michael. Did you want to do that first?
Sure, Michael, there's a question here. Who was preparing those spreadsheets in Winnipeg that were sent over to you?
Oh, well, I'm not sure. I got it from the administrator, so maybe it was him, maybe not. Yeah. Yeah, I mean, I guess there's different ways to do it. I mean, some of you already may have automated systems for admitting people, so I don't, but again, it's just a lot of that stuff doesn't take very long to compile for new admission, unless you have, you know, 50 or 60 people coming in a week. It wouldn't, I don't think it would take you that long to put something together. And a lot of that, I mean, you know what, it's on the file already, or should be. I would think that people would have that information at hand.
Okay, Irene.
Yeah, I think everything that Hannah and Michael had said, just right on. Some really awesome suggestions about how to start things. And I was just going to comment, also add about the critical importance of the leadership around evaluation. So if you as a leader in the organization are not fully 100% committed to the value of evaluation and wanting to do it, it will not happen. It's just pretty simple. So I think that's really the first step. And if people need to get there, you know, there's I mean, lots of expertise here and lots of kind of reading or conferences one can go to really get to the depth of why it's important for your organization to do it. And there's a lot of really good reasons, but that's the first thing. If you have leadership commitment, then everything else follows. So what I would then say is it's the engaging the staff as well in conversation about evaluation. And that means starting to, I think that Hannah said this too, but starting to talk about what is it, or maybe Michael, what is it that we want to accomplish? You know, why are we doing what we're doing? What are we seeking to see? What kind of, you know, to start people kind of meaningfully engage with their work. And I think a lot of staff, if they're able to do that, then they feel a lot more engaged with their work, and it's not just same old every day. So I think that's the beginning step. And in some ways, if there's leadership and the staff are engaged, then you can have conversations with your funder about, look, this is where we're at. We're already moving in that direction and we need some support. And I think I would also say that it might sometimes sound like evaluation is a complex undertaking and a really big, complicated thing. But just like Michael was saying, Excel can address your needs, you know, and I think just doing things in small increments can also work. Right? Maybe you just start by you know, tracking your intake information, or just tracking some contact information. Right? Maybe you don't get to outcomes, but you can go little by little to the full comprehensive evaluation. And I think if you engage with the funders through this process, you know, in kind of relationship building with them and helping them understand why you're doing what you're doing, and that you're committed to this independent of whether or not there's money, right? Because that's really critical. And then they can see that you are interested in doing this, and you are very likely to have an uptake on this. So I would say, yeah, that would be my comment, is that it starts at the top. There needs to be commitment at the top. And then it doesn't have to be a big, complicated undertaking. You can do it a little piece at a time.
Okay, thanks everybody. Okay, I don't see any more questions in the chat. So I think we're, unless anyone on our of our panelists wants to add a final comment, I think we're about ready to close. And maybe is there a final comment from anyone, or no?
If I could add, thank you so much to all four of you for enlightening us on the techniques and challenges and successes you've had with your evaluations. I have to say, for me, even just hearing the title evaluation and monitoring, it's very overwhelming. So you really were able to break it down and make it seem like, I believe, Irene, you were just saying, do it in small steps. So it just naturally happens organically. And it's certainly something that, as one of the unfunded programs here in Brampton, we could take with us. So really valuable lessons and insight. Thank you so much for your time today. I really do appreciate it. And I'm sure that myself and other people who have been watching today will reach out as you've offered for some help. So thank you so much. And I hope you enjoy the rest of your day and stay well.